It's my pleasure right now to introduce Chief Justice Loretta Rush of the Indiana Supreme Judicial Court. She is our Pillar of Excellence Criminal Justice Awardee this year. And Judge Rush took the oath of office as Indiana's 108th Supreme Court Justice in 2012. Has been Chief Justice since 2014. Chief Justice Rush is President-elect of the Conference of Chief Justices Board of Directors, is a member of the National Center for State Courts Board of Directors, served as co-chair of the National Judicial Opioid Task Force. She was appointed by Chief Justice John Roberts to serve as a member of the Judicial Conference Committee on Federal State Jurisdiction and is a National Judicial Task Force. She's on the National Judicial Task Force to examine state courts' response to mental illness executive committee member. It's for all these reasons and more that we are honored to award the 2021 Pillar of Excellence in Criminal Justice to Chief Justice Loretta Rush. Congratulations, Judge.
Thank you very much. You want me to make comments now? I don't.
Sure, you could, whatever you want. It's your time.
I can do it late. No, I was trying to see what the pause was for. Was that for me to start my comments, or?
You could start your presentation now. Again, congratulations.
I can wait.
Well, just a really quick sort of one thank you and add-on is, for those of you that don't know, Justice Rush is also the star of a series of courses and pieces that we've put out in partnership with NIH and NIDA to judges and court staff across the country. And your commitment to this issue is just so amazing, Judge. We're really grateful to you at Addiction Policy Forum. We're so grateful for our partnership and being able to work together. We titled this the Pillar of Excellence Award because it's the pillars in our community like you that are driving innovation and helping us to change how we respond to addiction. So thank you so much.
Oh, thank you. And thank you for this award. I'm pleased to have it, but it's shared by the 30,000 trial court judges that are out there around the country. And let me just explain just a little bit. I'll take my few moments, just talk about the state court's role. I've been a judge since 1999. I was a juvenile judge before that, before I was appointed to the court, and then I was appointed Chief Justice shortly after I got out of the court. So I've been a judge through, and I've been in courtrooms for the last 40 years, and I've sort of seen what drugs have done to litigants, how the court system has dealt with drugs, and hopefully the evolving nature of the court's response to drugs. In 2017, I was asked by the Conference of Chief Justices, do you think we should have a national judicial opioid task force? And I said, yes, you should have had one 5 years ago. We frankly should have done it during the crack cocaine when we saw children, families, communities destroyed by that, but it's time. So they go, great, then you get to chair it. So you're sitting there, okay, all right. I don't think there was a bigger issue in our courts than what the effects of substance use disorder and opioid use disorder on the litigants at the time, just losing so many people. And now, I mean, our governor just announced yesterday, we've had a 33% increase in overdose deaths. So we're not winning this war, but we're trying to be smarter. The judicial system, we're good at getting tough on drugs, right? We know how to, I mean, I see huge drug sentences, but how do we get smarter on drugs? So in my research, I'm looking at what levers the state courts can pull with regard to working to improve this tidal wave of addictions and the lack of any kind of good judicial system response. You know, I met with some people, and one of my friends was Dr. Jerome Adams, who was our former Surgeon General. He's from Indiana. We had worked on substance abuse issues in Indiana together. He'd started the syringe program here. And he was like, you know, you really need to, what is your lane? What are the levers you can pull? Because that's it. The authority of the courts with regard to working on this issue is huge, but do we know how to do it? So you have to first look, 99% of the criminal cases in the country are in the state courts. 96% of the civil cases are in the state courts. And again, this is not just a criminal court issue. All our dockets are affected by substance abuse. It could be guardianship, custody, evictions, workman's comp cases, foreclosure, debt. So we need to, one, look at the scope of the problem And then the other big issue for me was sort of an aha moment on addictions is the number one referral source to get somebody to treatment other than self-referral is the justice system. And that was depressing to me because I said, it's us. So one, we've got to educate our judges. I mean, for a while there, judges, they didn't understand medication-assisted treatment. We're still working on best practices. Substance use disorder is a chronic treatable medical condition. It's not a moral failure. And to train we have to first train our judges and come up with a curriculum. And we work with experts, cross-field experts from around the country. We sent judges to train with doctors on how to come back and train our judges on how the brain works. And, judges like to learn, but we need to learn what to learn and how to do it. So we had to really break it down into training modules for one. It's working because you see that it's not just this, separate the criminal activity from the addiction issue. And how do you treat the addiction issue? We have the authority of the courts. We have sort of the pulpit of dispositional orders and sentencing orders, and how can we do that better? We also looked at best practices, what was working across the country so we could get those models, and we set up pilot programs throughout the country. We did transfer agreements where we could transfer dealing with our indigenous population from state courts into tribal courts, wellness courts with regard to them getting treatment. How do you transfer a veteran from federal court into state courts? A wonderful program that we modeled from Montana. We had judges convene summits. And we did sort of a model one in Indiana where we brought judges, community health providers, therapists, sheriffs, probation, prosecutors. I mean, the continuum of who deal with addictions in the community. And every county came, and we had treatment on the science of addiction, medication-assisted treatment. And we actually surveyed before and after, what were your thoughts? Because I've had judges that say, I will never approve buprenorphine, Suboxone, methadone, where we need to have them morph into, we are not scientists, we are judges, and we need to get the best medical information available to us because we know with somebody with opioid use disorder what can work and what can sort of change their lives. So we've done a lot of training. We've probably done trainings that have reached millions of people, probably 50,000 live. We have printed materials at the National Center for State Courts, and we developed a series of toolkits, kind of bench cards, quick references, how to refer to somebody with a substance use disorder in court. Don't refer to them as an addict. Don't refer to it as a dirty screen. Understand relapse. We set up a model for family recovery courts. When can you safely leave a child with a mother or with a family as a mother's going through recovery for better outcomes for not just the moms, but for the kids. So we have exponentially grown family recovery courts in child welfare. We also talk to our judges because what's in the center of every community? That courthouse, and who's in that courthouse as a judge. Use your power. I call them superpowers of convening. Like it or not, judges, you call a meeting, people show up in your community. So how do you get these people to come to the table? We use the sequential intercept model that many of you are probably aware of. We're doing it in mental health now, but where does somebody with substance use disorder hit in your community? From 911, which I hope will soon be 988, through the arrest, through if they come to court, to getting back in the community. What are we doing in our jails? 25 years ago, only 25% of the people in jail were there on a pretrial basis. Now it's 75%. Our jails have become sort of the de facto substance abuse mental health. And how are we helping our jails, equipping our jails, diverting from jail, and then looking at the high risk of overdose when somebody leaves jail? So we brought strategies, court-based programs, programs for diversion, training, and then not just for judges, but for probation officers, community corrections, sort of all the elements of people that touch a family within it. We also did a big focus on children, adolescents. We had bench cards on things like what is medication-assisted treatment for a pregnant woman? What is it for an adolescent? What does the science show? So this was all new to us. And, we had some resistant judges. Well, I'm just here to judge. I'm not a social scientist. And I thought, well, if you are the number one referral source to get somebody from treatment and you don't understand how to get them into evidence-based best practice treatment, then that's not what you were elected for. And that's not part of the oath that you took. So what we decided to do at the National Center for State Courts is once we did this, and we're still working on it, and again, the materials are all online, we actually work with the American Association of Psychiatrists and have a medical legal brochure with best practices for courts to use. We're also doing mental health now because you can't just deal with substance abuse without looking at co-occurring in the mental health. So I'm actually on the executive committee on the National Mental Health Task Force, and we've sort of restructured at the Conference of Chief Justices how it's not just, we used to kind of have this problem-solving bucket, we'd put everything in that problem-solving, but this is beyond just what we're able to do in problem-solving courts. We're looking at what is the court's response to the behavioral health needs of those that come before us, and how do we work at the macro level? For me as Chief Justice, we're seeing more and more states put a behavioral health specialist embody them in their administrative structure in the state to help guide us in this. But again, since it's not just a criminal justice issue, this is the mental health and substance abuse and behavioral health needs. I really challenge anybody to find some docket that doesn't have those needs of a litigant. So I've probably talked too long, but those are some of the initiatives. There's a lot of work to be done now. Collecting data is important. We're having regional opioid and groups that got together. So I'm here in Indiana. We work with Kentucky, Ohio, all our surrounding states with regard to, there's so many cross-state, so much cross-state information that we have and that can share in best practices. So we've set up those in different parts around the country as well. And again, I thank you for the work and really thank you for recognizing sort of the state court's role in this, because that helps keep our feet to the fire. When I start talking to sort of the Office of National, Drug Court Professionals, the Office of National Drug Court Policy, they go, we don't really think about the state courts being involved. And it's important. So when this money comes, like state opioid response, I'm always talking to legislators, think about the levers we pull in the state courts. We maybe don't have cartels. We have sort of the person that's sitting in jail for possession of a syringe, or a mother whose children are all sitting in foster care as she's going through recovery. But we are big players, and it's a big responsibility. And my job and the job of the Conference of Chief Justices is to continue to push to pull those levers towards solutions that we can do. But I thank you, and I need to Deborah Taylor Tate, who is my co-chair, just is a dynamo from Tennessee, and I'm going to accept this on behalf of both of us.
Thank you very much, Chief Rush. You're doing amazing work, and it's been a pleasure working with you, on some of the work we're doing, and you're doing incredible work across the country. Any of the attendees, if you all have questions, feel free to shoot them into the chat. I don't see any right now, but Judge Rancourt or Jess, do you have any questions or any comments?
Well, I certainly have a comment. Congratulations, Chief Justice Rush. I was involved in the justice system from '76 all the way to 2000 when I retired as a district court judge in Minnesota. And some of the things you indicate today are so relevant. I remember back in 2002 when I got on the bench, I got a call from Kathleen Blatz. I don't know if you know Kathleen, but she was a Chief Justice in Minnesota, and indicated to me at the time that I'd like you to start looking at the impact of alcohol and drugs on the courts. I had very little knowledge of that, and they sent me out for some training, and I did that. And at that time, we got involved with drug treatment courts back in 2001. I think we had 2 of them in the state of Minnesota. I was named co-chair of the Drug Court Initiative Advisory Committee, along with one of our prosecutors in the state. Was really a tough guy on law and order, so it was a good combination, if you will. And when we finished, I think we ended up with about 38 drug treatment courts. But as you know, during that period of time, it was like pushing a rock up a hill. So many of our judges, because of, I think, lack of education on this subject, pushed back so hard on that. As you've indicated, I did not want to be, I'd hear from them, look, I'm not a social worker, I'm a judge. That's up to them to work on. And as I indicated to them, as you have indicated, Chief Justice, look, how do you properly sentence somebody if you don't understand the aspects of substance use disorder? How do you work with trying to reunite a mother with a child if you don't understand substance use disorder? And one of the things you said today really is something I've really been an advocate about. And that's not, you know, we always refer to these issues as the criminal justice system. And to me, that was a stigma by itself, that anybody that's using substances is all of a sudden a criminal. Well, that's not true, as you've indicated. There's so many case types that we deal with that are impacted by substance use disorders. So as a result, I think I trained over 100 judges in the state of Minnesota on the issues that you're talking about today. But what I want to really say to you is that the Chief Justice role, for anybody that really doesn't understand that, is so critical to the bench as far as state trial judges and supporting change and reform of the justice system. And someone like yourself that has done so much, Chief Justice, in this area is so well deserving of the award you received today. And I thank you so much for your efforts and continue your good work. So thank you.
You sort of raised a good point. You know, our courts are different than the federal courts because we have an Indiana Constitution, which sets out my role. And my role is as head of the judicial branch of the state, and I'm in charge of the administration of justice in Indiana, which will include judicial training. So you can sort of set this path for your entire state. And that's where I tell judges, and I don't like the word bully pulpit, but I tell Chief Justices, use your super convening power to push this on down, be that model for them that's important. And, you know, look at in Indiana, we have like 130 problem-solving courts, and we're growing them fast. We're really looking at these family recovery courts on substance abuse. So thank you. I appreciate your observations.
And Chief Justice Rush, we do have a couple questions coming in. One from Lisa. You mentioned those bench cards with some suggestions for judges on appropriate language around SUD. Are those available to the public, or can they?
They are. The National Center for State Courts, National Judicial Opioid Task Force, and you will find there's a book that's also on there that is the summary of it, but the bench cards themselves come in a packet, and you can download them, right? But no, they're free and accessible. And if you have a hard time finding them, get a hold of me at loretta.rush@courts.in.gov, and I'll make sure that you get them, because we had states buy them for every judge. I mean, we had to print out in that. We also have a substance use disorder dictionary on terms. There's a lot of terms for us judges to learn, and then what the language. So we do have those. They're free. Use them. We're also doing them now very much on mental health, and we've just started building our deliverables. We have a really good one on competency restoration, and again, there's a lot of co-occurring. And competency restoration spends a lot of people with mental health and co-occurring disorders, where they are, where they're placed, what services you have for them within the court system.
Great, thank you. And we'll make sure to share some of this information with all the attendees after today's conference. We have another question from Irene. Do you have any suggestions on how treatment providers could collaborate with judges and kind of start that conversation of working together, especially in a rural area such as Western Maryland?
Maryland's got, your former Chief Justice was just a dynamo, and I don't know a lot about your current one, but there's pretty robust programs. But I would contact your local judge. Look at, the Maryland Supreme Court Office of Administration, go to their webpage and they'll have information. But I also told treatment providers, come to court. Go to court, go introduce yourself to the judge, and invite them for a cup of coffees to start that conversation with regard to, because that's the model we're promoting. And I know that's the model that Mary Ellen Barbara, the former Chief Justice in Maryland, was also promoting. So if you have problems getting a hold of a judge in your area, you can get a hold of the National Center State Courts, or you can get a hold of me, and I'll put you in contact with who you need to get a hold of. Because I think those dialogues are key. And the medical legal dictionary in the task force that we did, we relied on treatment providers to help build our program for training justice partners on best practices. So I think it's a wonderful place to start. I always tell judges, you better know your community mental health provider and your treatment providers, particularly in rural communities, because they don't have access to many materials. So I'm hoping something post-COVID that has happened is that with virtual treatment, it's not, it's maybe not ideal, but man, we can reach a lot of people with that. So definitely get something set. You can also contact your probation department, who's the head of your probation department, and start the dialogue with them as well, because they also help connect treatment to the courts. Great question, Irene.
Great. We have one more from Susan. Susan's a clinical educator with providers and informing them that NOI that can be now submitted to treat OUD. Most providers are still afraid of treating their own patients. Providers are the most stigmatizing towards OUD treatment. Do you have any suggestions on how they may address this?
I don't know if I understand that question completely. Providers are the most stigmatizing towards OUD treatment. I thought courts were. I'm not sure I understand the question. Most providers are still afraid of treating their own patients. I
think it might be that there's still a lot of reticence to make medications for opioid use disorder available. And we find some of those concerns or some outdated thinking around MAT, even in the provider community or in different communities. So in some places, judges actually might be better informed and have more information about the latest treatments than even folks that are on the sort of specialty treatment or in healthcare systems. One thing I just like a comment to that, and I'll kick it to you, Justice Rush, but you mentioned that you can have people show up. And so I think that it's an important role that our judges can play, and even making their whole community more aware of evidence-based practice to treat addiction, such as all that we know about how effective medications are to treat opioid use disorder.
And I think what we had with regard to MAT, and we have some bench cards on MAT that you can look at too. Feel free, because we had SAMHSA. We had people peer review ours that are specialists in this area before we put out a bench card saying that medication-assisted treatment is the best practice. And it's like, if you don't use medication, and I don't have the bench card in front of me right now, but it's like 90% effective. It's a huge chance of help for somebody with opioid use disorder medication. Now, it's not for all substance abuse disorder, but we actually have the statistics in there on the likelihood of success. So why, if you just do traditional therapy and it's got a 2% chance of somebody with opioid use disorder, would you not use it's like somebody has cancer. Would you really go in and say, listen, we can go and give you an aspirin, or we can give you chemotherapy? And I always tell judges, would you ever tell somebody coming to your court, no, I'm sorry, I just, I don't believe in, radiation or chemotherapy. So we had to look at it. So we had SAMHSA, we had the top medical people in the country sort of approve this for our judges to do the treatment, and that very much helped with that. Because there is a lot. I have some judges say, listen, I only like Vivitrol. I go, what, just the shot? I said, well, where are you getting that expertise from? Well, it's the shot, and I know it won't be abused like methadone can. So we have a lot of training, and we still have a lot of training to do, but I hope I got to get the providers on board, right? How are we going to get the judges on board if the providers aren't there as well? There is a medical legal dictionary that AAPA and the National Center for State Courts and the Opioid Task Force put out. Comes in a booklet form, and you can actually get that. They're sending them to you at no cost. And I'll have somebody, I'll send you the link where you can get that, which will have some of that terminology available as well. And I had a judge cross-examine the doctors at 1,000 people at the Opioid Summit about, well, you're just substituting one drug for another. And it was a really great exchange. And the questions were answered, and it really put my judges very much more at ease in understanding medication, the benefits of medication-assisted treatment for opioid use disorder.
Great. That's fantastic. We're going to use your segment here and replay it often. I love your connection and comparison to sort of having feelings about chemotherapy versus an aspirin. I think that is a beautiful way to sort of summarize this. We'll make sure that we'll share on our conference website all the bench cards and resources from the National Center for State Courts that you've referenced, Justice Rush. And so we'll get that out to our attendees, and just very, very grateful to you and all the work that you do.
Great. Well, thank you for all. You keep on keeping on as well. Thank you very much. Thank all of you. Bye.